Hey guys, Don here. Welcome to Podiatry Practice Mastery. I'm going to go over the $1 Million Minute, the things that helped me get to the practice to the $1 Million mark and beyond. So we are starting week 4 of our medical record translocation, moving from Athena to ModMed. A couple of the snafus are, which I think are going to be good in the end, like billing for Qutenza. So there's is something in there, but there's not the code for the actual doctor doing it code. There's the code for the buy and bill, but sometimes they're doing it through a third party like Walgreens or something like that. Also, things that are kind of messing me up a little bit are like in-office dispensing. It's not a great way of doing in-office dispensing and communicating to the staff. There's something like in-house purchases, so we have to make those up for what things patients buy. The shockwave is going well, and it puts in the cash pay as well. Swift is going well, but we're still kind of working on it. I really do like Clara though. Clara is the way of communicating with patients, but as well communicating with patients before their appointments and after their appointments, and asking for online reviews, and also for scheduling the appointments. So it's kind of making it much more available. So we're excited about that. I was talking to my virtual assistant that's working on a new web page, like an urgent care web page she's working on, and on there we're going to have this link so patients can see who's available that day and then make an appointment. We're not going to have like an actual walk-in. That's not really going to be feasible for us because otherwise they'd just be waiting a long time. I don't think that's going to be possible, but I think the making the same day appointments is going to work well. Okay, so today I'm recording. This is for a Thursday. And first patient was a 61-year-old female. She had a nail sample. She had failed Lamisil and diflucan, and I did a nail sample for her, but these were like a lot of years ago that she did that, so I took a new nail sample. Next was a 71-year-old male with an orthotic follow-up, doing much better with the orthotics. No follow-up for him. 68-year-old female had lesion destruction, nails debrided, and I did a nail sample, so they're going to come back in 3 weeks to go over that nail sample. Next was a 71-year-old male with an orthotic follow-up, doing well. The goods and the bads of doing orthotics, there's a lot of orthotic follow-up appointments. Usually they're pretty normal, but there tend to be lower-level visits. I'm always thought of doing my orthotics kind of like my paronychia follow-ups, doing them in a 10-minute slot, and then double booking them with other ones because they're kind of quick. Next was a 55-year-old, number 2 out of 6 for a sesamoid fracture. He's not really seeing much improvement yet. I usually tell patients they tend to start seeing improvements about week 5 or 6. Next was a 47-year-old male for right bunion. He wanted to schedule surgery, so that was scheduled for him. Next was a 34-year-old male for Swift number 2 out of 4, seeing a little bit of improvement. Next was a 55-year-old female for a Lamisil booster. Next was a 68-year-old female that had midfoot injection. She had a second met cuneiform joint pain, and we also scanned her for orthotics. Next was a 55-year-old female that had bilateral equinus, did a injection, foam rolling for this patient, and they're going to come back as needed if the pain comes back, most likely doing shockwave. Next was an 88-year-old female, had callus care and nail care, just as somehow they got into my schedule for nail care, but I think it was a new patient. New patients can kind of find their way in. Next was the 66-year-old female that had a right medial 5th digit toe exostectomy, so I did that in the office. That's one of my favorite little procedures to do, where I take a little blade and then I take a rasp and rasp it down in the office. Next was a 67-year-old female that had arthritis on the 2nd digit. And I'm not sure what I did. I can't read my handwriting. I'm not used to this new tracking system here. My other one had, when I printed it out, my daily sheet, I could see what they were here for, but this new one I can't do that. So I'm figuring out a different way, and I can't read my handwriting. Next was a 31-year-old female with an IND for bilateral big toenails. Next was a 68-year-old male for nail care. 37-year-old patient that was on Sporanox, and it was getting better. So itraconazole getting better, and so I'm going to keep him on it for a little bit longer. Next was an 18-year-old bilateral matrixectomy. Then there's one of my last patients was a 77-year-old, had a dislocated 5th toe. I don't really see this, but I guess he dropped like a file cabinet, he said, on his 5th toe, and it dislocated. So I used a toe fracture code, fracture dislocation. And so I got that, and then I just had him tape it together. But I didn't really want to pin it in place because it didn't look all that bad. It was just swollen. And then the next one was a second met fracture. And this one I did I couldn't really tell. Actually, no, this was the one that was a bad one. And I actually thought he needed surgery, but he was like one of these hard-working men. He dropped something on his foot. It was a fracture. If you were listening, I told it a while ago, but it was almost like dorsally dislocated. And it kind of peaked dorsally, and there's almost like sticking up in his skin. But it formed a huge callus formation around it, and it's starting to heal. So it's just amazing. No matter how bad these fractures are, most of them heal pretty well. So this has a lot of callus formation around it. It's doing well. And so that was kind of the day. So it was a busy day. I was able to get out of the office by 5 o'clock, so that is a big win. And then today I'm recording this is on a Friday. So I had a morning without Marjorie. Marjorie had her birthday. It was my nail tech. And so I had a couple of patients. I did a nail sample, callus care. She had a rash on her foot, so I did clobetasol. Another patient did ABIs. And I'm starting to reorder the ABIs. I'm not quite there yet. What I usually do is, if they haven't done it in a year, I can put it in the medical record to do an ABI and a diabetic foot exam. With the ABI, the nice thing about ModMed is it has this designation of why they need it. And it has like over the age of 50 with diabetes or over the age of 65. And that's usually what I'm doing it for yearly, and so it's in there. I also did a Swift today, a woman with bilateral ulcers on her toes, and then a patient that wanted lunula, but I kind of talked her into doing Trabefen because that's just kind of what I do. I think lunula gets them in the office because they search for us online, but then I don't do that much of it because I don't think it works that great in my experience. So that was the day. Things are going well. I feel more confident with ModMed. Morali, my scribe, is getting the hang of it, so it's giving me a little bit more time to work on other things and kind of focus on perfecting the notes. And within ModMed, there's a lot of these stickies, they call it. So these are written verbiage that you can change and save. So we have, I'm trying to kind of fix those. Morali, my scribe, can't do that. I have to fix them, but then he can use them in the future. So that's what it is. So I hope you guys have a good rest of the week, and thanks for listening. Have a good one.